It's another deadly day in this pandemic, with more than 50 people losing their lives with COVID. As hospital numbers keep climbing, states are starting to assess when their Omicron outbreaks will reach their peak. Australia's Chief Medical Officer says there are signs for hope.
We're not through it yet. I think there are still going to be large numbers of cases diagnosed in Australia over the next few weeks. Minister has already mentioned the effect of that on our hospital system, intensive care, ventilation and so forth. We are plotting that very, very carefully every day, checking that data. But every week there is a published summary of that, the common operating picture that's been going for well over a year now. And if we look at every single state and at the national level, no state or at the national level has reached anywhere near a strain that we would be concerned about in terms of numbers of cases in hospital.
New South Wales has recorded another 20 deaths today and more than 48,000 cases. Reporter Cecilia Connell has the details from Sydney.
In the 24 hours to 8 p.m. last night, more than 48,000 COVID cases were recorded in New South Wales. To break this down, around 27,000 of these were recorded via PCR testing and around 21,000 from self-reported rapid antigen tests. Health authorities say of that rapid antigen test number, around 15,000 of these are from the past 7 days. So today's overall figure of more than 48,000 cases compared to yesterday, that's a dip of around 14,000 cases. But health authorities have said all along, particularly since the launch of being able to register rapid antigen tests on the Service New South Wales app, that this figure is likely to bounce around as people record historic rapid antigen test results from the start of the year. And indeed, this figure could include people who have recorded more than one rapid antigen test. So that figure of 48,000 today is subject to change. Now, in terms of hospitalisations, that figure is over 2,500 today, the same ballpark figure as yesterday, Casey. But if we break that down further, there's 193 patients in intensive care, which is a rise of 9 patients on the previous reporting period, and 58 of these patients require ventilation. Sadly, the state has recorded another 20 deaths in the latest reporting period. They include 11 men and 9 women. One of the people that passed away in the latest reporting period was a man who passed away in his 20s at the Albury Base Hospital. He'd received 2 doses of a vaccine and had underlying health conditions. New South Wales Health have extended their deepest condolences to the families of all of those people, and that brings the total number of deaths in New South Wales since the pandemic began to 848. If we turn to the vaccination rate briefly, Casey, in terms of booster shots, just over 24% of the state's adult population have now had 3 doses of a vaccine. And if we look closely at the 5 to 11-year age cohort, which of course opened in terms of the vaccination rollout on Monday, just under 9% of that age bracket have now received a single dose of the vaccine.
To Victoria now, where there have been another 23 deaths. Hospitalisations have surpassed 1,000 and there are more than 100 people in the ICU. 30 of those are on ventilators. There are 25,000 new COVID cases in the state today and over half were detected from rapid tests.
Over 1,000 people now requiring significant care in our hospitals with COVID. We continue to expect to see those numbers to go up in the weeks ahead. And of course, that means a significant pressure for our doctors, our nurses, our clinicians, and all the support staff that are working in our hospital system and who've been working so hard for many, many years now.
On to South Australia, where 4 more people have died from the virus. There are 236 people in hospital, a drop of 10 from yesterday, including 26 patients in ICU and 7 on ventilators. The state recorded 4,349 cases, down from yesterday's total of 5,679. Premier Stephen Marshall says the state's now focusing on vaccinating 5 to 11-year-olds.
Our first major announcement today is that as of Monday, the Enfield vaccination clinic will become a family-only clinic, and this will provide an additional 700 5 to 11-year-old appointments per week. We're looking for as many opportunities as we can to get jabs into the arms of all South Australians.
Queensland has recorded 6 COVID-related deaths today, including one person in their 20s. Over 600 people are in hospital, including 46 in the ICU, 14 of whom are on ventilators. The state recorded just under 20,000 new infections, and just under a third of those are from rapid tests. The state's health minister says more kits will be made available at testing sites.
We did get some of the some additional supply of rapid antigen tests yesterday. We are expecting more to arrive today and more over the next couple of days, and we're just waiting for confirmation from the Commonwealth when our orders will arrive for those as well. But we're pleased that we are seeing some extra come in, and we are distributing some of those to our public testing sites and also, of course, to our public health units.
After nearly 2 years of Queensland's borders opening and closing to interstate travel, the wall preventing entry from New South Wales has finally been taken down. Dominic Cansdale has more from the border in Coolangatta on the Gold Coast.
There's no other way to describe the mood here in Coolangatta, right on the Queensland-New South Wales border, as being one of a total vibe. As you can see behind me, there's hundreds of people out enjoying the surf here at Greenmount Beach, and just across the border, speaking to locals, businesses, even stall holders at the local farmers markets and Tweed Heads. There's just this sense of relief. Finally, after 471 days, the border barricades, the border controls are gone. And from what police tell us yesterday, they're gone for good. Queensland is approaching a double-dose vaccination rate of 90%, which means the border barricades no longer really serve a purpose. They were there to prevent the spread of the virus into Queensland. Now, locals across this area have had a really rough trot over the past 2 years. Anyone familiar with the area will know that Coolangatta on Queensland side, Tweed Heads on New South Wales side, they're essentially the same town. You cross the road, you're in New South Wales. You go back across the road, you're in Queensland. So for more than 470 days, locals have had to deal with keeping up to date up to the restrictions, who can and can't cross the border, just the traffic delays. Sometimes they'll stretch from 5 minutes, 20 minutes to 3 hours at worst. When recent border controls were relieved, we were seeing delays of like 6 hours. So it's been a real cat and mouse game for locals trying to just navigate getting around town, and for businesses just having that regular flow of customers back again from Queensland and New South Wales, vice versa. It's just a really, really positive mood on the Gold Coast. We've also seen today right on the border, another anti-mandate protest. That has been a very regular spot for these protests. I think there's been about half a dozen over the past 2 years. But on a plus side for businesses, it's probably a good thing. They've got hundreds more of these protesters visiting their cafes, buying coffees, buying lunch, that sort of thing. But overall, it's just a true sense of happiness that finally these border barricades are a thing of the past.
Tasmania has recorded just over 1,000 new cases. There are 22 people in hospital, only 10 of them being treated for their COVID infection. One person is in intensive care. And in the ACT, there's a record number of people in hospital with COVID. 30 people are being treated, 3 are in the ICU. More than 1,300 cases have been recorded in the past day.